Thank you. Minister Diab, while there are roughly 80,000 foreign-trained medical professionals in this country not working in healthcare, a recent news article confirmed that there are licensed practicing doctors in Canada today that have various suspensions or outright bans in other jurisdictions due to misconduct or malpractice. My question is a yes or no, when someone lies on their immigration form or during the process to be accepted into Canada, is that considered immigration fraud? Yes or no, please? Immigration fraud, yes or no, please?
If somebody lies on their immigration papers to come into Canada, those obviously there's security process, and there's if it's a fraudulent claim and if it's misrepresentation, they're definitely dealt with by CBSA. Absolutely.
A recent news article pointed to an investigation that uncovered doctors in Canada were practicing with reprimands, suspensions, or outright revocations of their licenses in other countries. In the past 10 years, how many people have been admitted into Canada by the Federal Immigration Department with suspensions or revoked medical licenses in other countries?
Suspensions, revocations of medical, all of that is handled by licensing bodies and health.
Don't know. It's okay. You don't know.
And the provinces, I mean.
If you don't know the number, why would you authorize the continuation of a system that you admit is kind of fraudulent when these people are entering in our country and not being truthful?
Again, I don't know what people you're talking about or what specific people you're talking about.
Okay,
We're here to talk about our immigration system,
sure.
but also our
One of the
foreign,
examples is an article involving a doctor that was publicly reprimanded and fined in Florida for potentially lethally overprescribing in 2018. A public record that takes 30 seconds to find on Google. Why did your immigration department wave him through without catching the fraud that a journalist found? And that's without government resources.
cases are dealt with appropriately by IRCC, CBSA, CSIS, screening departments, officers, and if it's to do with health and licensing bodies, then obviously we defer to licensing bodies, provincial, territorial jurisdictions. They're the ones who, policing, who are also governed by provinces and territories.
Thank you. Yeah. Minister, yes or no, does the Immigration Department currently require a simple basic search of the U.S. National Practitioner Databank or the UK GMC sanctions list, for example, before granting entry or permanent residency to an individual with reprimands or license suspensions? If the answer is no, how is that not deliberate negligence?
So if you're asking if a person that's coming to practice medicine, that's what the licensing bodies and the employers, who are the hospitals or the institutions, that is their role in terms of verifying all of these before the individual is able to practice in Canada.
So we don't double check. So Immigration, Refugees and Citizenship Canada justifies failing to mandate independent verification in express entry for medical professionals, effectively allowing those evading bans abroad to exploit Canada's skilled worker stream. And I can read the question again if you like.
Sorry, Mr. Burton. I don't think the minister asked for that. Go ahead, Ms.
Okay.
Minister.
So thank you for that. Sure. Again, if I speak on my personal experience as a provincial minister, I was in Ireland and UK, and at the time I was recruiting doctors, and I took with me the College of Physicians. I took with me the hospital director from the hospital, who was the employer, and and that's what their job were. That's what we were there as facilitators from the immigration department. But all of that work gets done by the licensing bodies, by the employers or the hospitals. There are many players when you're talking about the health professionals, particularly doctors and the likes of what you are referring to. This is not something just that somebody in IRCC conducts. It's a whole of system approach.
Thank you. Yeah, and
Thank you, Mr. Burton. You have 9 seconds.
when refugees come, we do criminal record checks. But when we are recruiting medical professionals, we just leave it up to the provinces. And that's probably why we have 80,000 medical professionals that are not currently employed.
Can you wrap up? Thank you.
Anyone coming
Thank
to
you very
Canada
much.
is would not be admissible unless they pass the criminality check.
Thank you.